Hey guys, this is Dr. Yaker. Today I'm going to talk about Finasteride. We're going to do a quick overview in terms of when it started and what are the options available to you. So for many of you that don't know, in the early 80s, the ingredient Finasteride was patented, and in 1992, it became FDA approved under the name Proscar, which is a 5 milligram dose for the treatment of enlarged prostates. The funny thing is that when patients were coming back to see their physician, both the patient and the physician noticed that their hair was getting better. And in 1997, Propecia became FDA approved, which is a 1 milligram dose for the treatment of male pattern hair loss. Years later, in the late 2000s, the generic form, otherwise known as Finasteride, did become available to the public. And many of you who started with Propecia and were then able to move over to the generic form noticed a big difference in cost. In recent years, there have been pharmacies known as compounding pharmacies that are in your local area that can actually make the oral form of Finasteride that can also add other ingredients. And now, as of about 4 years ago, we can also make a topical form of Finasteride. There are pros and cons to both. One of the pros, of course, with oral is that it's much easier to use, whereas the topical, it is going to require a little bit more maintenance. But in another video, we will actually do a comparison on the oral form of Finasteride versus this newer topical form. For more information, you can log on to yakermd.com and please follow our YouTube channel. Thank you.